Joint pain is, honestly, a universal human experience. It can affect anyone, from an older adult struggling with the daily grind of osteoarthritis to a young athlete pushing their body to its limits. This persistent ache, often centered in the knees, hips, or shoulders, can really limit mobility and diminish quality of life. For many years, the primary treatments have been pain medications, which, as we know, can have side effects, or invasive surgeries like joint replacement. This has created a critical need for safer, more targeted therapies that can bridge the gap. We are constantly searching for ways to manage this chronic condition effectively, and one promising answer comes from a substance our own bodies produce. This substance is called hyaluronic acid, or HA. Think of it as nature's own lubricant and shock absorber. It is a key component of synovial fluid, the thick gel-like liquid that fills the space within our joints. In a healthy joint, this fluid is rich in HA, allowing the bones to glide past each other with minimal friction. It cushions the joint during high-impact activities like running or jumping. However, in conditions like osteoarthritis, the concentration and quality of this natural hyaluronic acid declines significantly. The synovial fluid becomes thinner and less effective, leading to increased friction, cartilage wear, and the familiar symptoms of pain and stiffness. The core idea behind hyaluronic acid injections, a procedure also known as viscosupplementation, is actually pretty straightforward. It aims to restore the natural balance within the joint. By injecting a purified, gel-like form of HA directly into the joint capsule, we are essentially replenishing this depleted supply of natural lubricant. The goal is to bring the synovial fluid back to a healthier, more viscous state. This simple act of supplementation can have profound effects, helping to restore the joint's smooth gliding motion and providing a cushion against the daily stresses and strains that cause so much discomfort for millions of people worldwide. This treatment isn't a cure for arthritis, but it represents a powerful tool for managing its symptoms. By directly addressing the mechanical problem within the joint, the loss of lubrication, it offers a different approach than traditional pain relievers that simply mask the pain signals sent to the brain. It is about restoring function and improving the joint's internal environment. For many patients who have not found relief with other conservative treatments, or for those who wish to delay the need for major surgery, viscosupplementation has emerged as a beacon of hope, offering a chance to regain mobility and live with less pain. When hyaluronic acid is injected into a joint like the knee, its most immediate effect is mechanical. It acts as a lubricant. Imagine adding thick, high-quality oil to a rusty hinge. The movement instantly becomes smoother and quieter. Similarly, the injected HA increases the viscosity or thickness of the joint's synovial fluid. This enhanced lubrication reduces the friction between the cartilage surfaces of the bones. As a result, everyday movements like walking, bending, or climbing stairs become less painful. The joint no longer grinds, instead, it glides. This simple restoration of smooth mechanics is the first step towards significant pain relief for many patients. Beyond just lubrication, hyaluronic acid injections also provide a crucial shock-absorbing function. Our joints, especially weight-bearing ones like the knees and hips, are constantly subjected to impact forces. Healthy synovial fluid acts as a cushion, distributing these forces evenly and protecting the underlying cartilage from damage. When this fluid thins out due to arthritis, the cartilage is left vulnerable. By replenishing the HA levels, these injections help restore that protective cushioning effect. This can be especially important for preventing further wear and tear on the joint cartilage, potentially slowing the progression of osteoarthritis over time by shielding the delicate surfaces from repeated impact. Another vital role of these injections is their ability to reduce inflammation. Joint pain is not just a mechanical issue. It is also a biological one driven by inflammation. Scientific studies have shown that hyaluronic acid can have a calming effect on the joint environment. It is believed to interact with cells in the joint lining or synovium, reducing the production of inflammatory molecules that trigger swelling and pain. By soothing this inflammation, HA injections can break the cycle of pain and tissue damage. This anti-inflammatory action helps explain why the pain relief from these injections can often last for several months, long after the initial lubricating effect. Perhaps most importantly, hyaluronic acid may also have a protective effect on the cartilage cells themselves, known as chondrocytes. There is growing evidence to suggest that HA can signal these cells to produce more of the body's own natural hyaluronic acid and other important components of cartilage. In this way, the treatment may do more than just temporarily supplement the joint fluid. It could potentially stimulate the joint to begin healing itself. This chondroprotective effect is an exciting area of ongoing research, as it suggests that viscosupplementation might not only relieve symptoms but also help preserve the long-term health of the joint cartilage. Not all hyaluronic acid injections are created equal. The products available on the market can be broadly categorized based on their molecular weight and structure. The main types include low molecular weight, high molecular weight, and cross-linked formulations. Low molecular weight products are closer in structure to the body's natural HA, but may be broken down more quickly, often requiring a series of 3 to 5 weekly injections. High molecular weight formulations are thicker and more resilient, designed to stay in the joint longer, sometimes providing relief from a single injection. Cross-linked HA is even more robust, as its molecules are chemically bonded together for maximum duration. The ideal candidate for viscosupplementation is someone with mild to moderate osteoarthritis, particularly of the knee. These are often individuals who have not found sufficient relief from first-line treatments like physical therapy or over-the-counter pain relievers such as acetaminophen or NSAIDs. They may also be patients who cannot tolerate these medications due to stomach, kidney, or heart issues. For them, HA injections offer a valuable alternative. Young athletes with early cartilage damage or joint stress may also benefit, as the treatment can help them manage symptoms and potentially delay the progression of joint degeneration while they continue to compete at a high level. However, this treatment is not suitable for everyone. Patients with severe bone-on-bone osteoarthritis may not experience significant benefits, as there is very little joint space left for the fluid to work effectively. Individuals with an active infection in or around the joint should not receive these injections, as it could worsen the infection. Similarly, people with known allergies to avian products should be cautious, as some earlier HA formulations were derived from rooster combs, though most modern products are now created through bacterial fermentation. A thorough discussion with a physician is essential to determine if this is the right course of action. In terms of safety, hyaluronic acid injections are generally considered a very safe procedure with a low risk of serious complications. The most common side effects are temporary and localized to the injection site. These can include mild pain, swelling, warmth, and redness around the joint. Some patients may experience what is known as a post-injection flare, where the joint becomes temporarily more painful and swollen for a few days. This reaction is usually managed with ice and rest. The risk of more serious complications, such as infection, is very low when the injection is performed by a trained medical professional using sterile techniques. The effectiveness of hyaluronic acid injections has been a topic of extensive study, and recent clinical trials continue to shed light on their benefits. A 2022 meta-analysis published in the Journal of Orthopedic Surgery and Research reviewed multiple studies and concluded that HA injections provided significant pain relief and functional improvement for patients with knee osteoarthritis compared to placebo. The analysis highlighted that the benefits were most pronounced several weeks after the injection and could last for up to 6 months. These studies reinforce what many clinicians see in practice: a meaningful reduction in pain that allows patients to resume their normal daily activities. Different products on the market, such as Synvis 1, which is a cross-linked single-injection high molecular weight formula, and Euflexa, a non-avian fermentation-derived HA, have been individually studied. For instance, a recent trial focusing on a single-injection cross-linked HA product demonstrated that a majority of patients experienced a 50% or greater reduction in knee pain by the 3-month mark. Another study comparing high and low molecular weight formulations suggested that while both are effective, high molecular weight injections may offer slightly longer lasting relief, which is a key advantage for patients who prefer fewer clinic visits. The evidence consistently points toward a reliable, if not universal, benefit for carefully selected patients. Looking ahead, the future of joint care is moving towards more personalized and regenerative approaches, and hyaluronic acid is at the center of this evolution. Researchers are exploring new formulations that combine HA with other therapeutic agents, such as corticosteroids for immediate inflammation control or platelet-rich plasma to enhance the body's own healing response. These combination therapies aim to provide both rapid symptom relief and long-term joint preservation. The goal is to move beyond simple symptom management and toward treatments that can actively improve the health of the joint tissue, potentially slowing or even halting the progression of arthritis. In conclusion, hyaluronic acid injections represent a valuable and well-established option in the modern orthopedic toolkit. They are best suited for individuals with mild to moderate osteoarthritis who are seeking an alternative to daily pain medications or a way to postpone major surgery. By restoring the natural lubrication and cushioning within the joint, reducing inflammation and potentially protecting cartilage, this treatment offers a path to improved function and a better quality of life. For the right patient, viscosupplementation is more than just a temporary fix. It is a strategic intervention that can help keep people moving comfortably and doing the things they love.